Good afternoon, everyone. Tom Stolz, County Manager, here to give the May 14th, 2020 Sedgwick County COVID update. The numbers today have gone up slightly. United States has gone from 1,375,949 to 1,398,393. That's a 1.6% change from yesterday. The state of Kansas had a 1% increase. That's 7,468 to 7,541. The Sedgwick County increase was 507 to 527, 20 additional positive cases for a 3.9% increase. The periphery counties, some change. Harvey has 11, Butler County has 19, Cowley County 3, Sumner County 5, and Reno County 51 positive COVID cases. In Sedgwick County, of the 527 positive cases that we have, there's been 322 recoveries, and we stand at 20 deaths as of today. The health department sampled 70 people today at our drive-through site on West Central. And KDHE is reporting that more than 7,100 residents have been tested for COVID-19 in Sedgwick County through all the partnership. As we've repeated, residents can be tested at no cost, regardless of insurance, if they have at least 2 symptoms of COVID-19 currently. To be screened, call 211 and go through the screening process there if interested in a test. I want to mention today also that the Commission took actions on allocating some of the $99 million from the CARES money that the county received. They heard yesterday from Tim Kaufman that we need additional positions in the health department to help us manage what we're calling these next few months of coexistence with the virus. We are temporarily going to add 47 positions to health, and that's everything from investigators to administration to trackers. So those positions will be, the money was approved to do that yesterday, $1.8 million. So that hiring process will begin shortly, and we can bolster our health department to help better prepare for the next few months of COVID management. They also allocated some money for election support, $420,000. We kind of forget about it sometimes, but we have a primary election coming up in August and a general in November. And we want to make sure that our polling sites are as safe as can be, and there's going to require some finance for that. So the Commission allocated $420,000 out of the CARES money to take care of that. We also allocated money for PPEs and some additional monies in contractuals and commodities for COVID-related expenses. Commodities $1.4 million and contractuals $500,000. So there's some pretty significant money that the Commission allocated for expenditure to help the county position itself in our battle against COVID over the next few months. One other thing I want to talk about, they did allocate $25,000 for some marketing and communications, and I just want to emphasize that that is a starting place for us. We all understand that our communications with the community, and I'm talking about things past website and things past commission meetings. I'm talking about billboards and PSAs and TV and radio advertisement. We know that's important, and we're going to begin to roll that out. So the Commission did approve some seed money to get that started, and we anticipate that that number will go up in the future because it's going to be very important for the next several months that we have good global types of communication within the area. So we have some community partners we're working on with that as well. Sedgwick County's local health and economic recovery plan, which I mentioned yesterday, can be found online. If you haven't had a chance to look at it yet, please do. And also check our website to look at our dashboard. We change something on that almost every day. So please keep up and look at that. It gives you a good idea demographically and what is going on within the community and the virus. www.sedgwickcounty.org. Phase 1 of the plan to reopen Kansas is still in place. Certain businesses and organizations are allowed to reopen in Sedgwick County if they follow social distancing and hygiene standards set by the governor's order. We are awaiting the governor's decision if the state will move into phase 2 or some other type of phasing process in the recovery plan. So hopefully that will be coming out from the governor's office today or tomorrow. That is all I have for today, and I thank you for joining us. We'll be back tomorrow with a further update.
Tom Jacob of K-Witch, is there, or talk about not knowing about phase 2 now, just a few days away. I'm sure you guys get calls. Is there any frustration there to not have that information yet?
No, we understand the governor's stress as she came forward with a phase plan, that you want as much data and as much time to assess where you're at in the current phase before you make a decision on the second phase. So we understand that. I don't know that we're frustrated at all. We, in our plan that we put out yesterday, we have mirrored phase 1, 2, and 3 with the governor's plan, and we're putting best practices and guidelines. We are playing that document like we're going to move ahead to phase 2. If she comes in with and keeps us in phase 1 or some lesser degree, we're prepared for that as well, because that existing document is out there. So we will, understanding the dynamics of this situation and how we have to roll, we will be able to react quickly with whatever her decision is on moving forward.
But then the anticipation from you guys is we will move forward on the 18th then? Our document, our actions, everything we're putting on our site is that the phases will move as planned. If they do not, and if we have to stay in a certain phase or a certain facet of a phase, we're ready for that too, and we'll do the best we can to interpret her data, get it on our website, and put it out locally. As I'm sure you guys will too. You guys will be interpreting that and putting it out to your viewers. And then I just had one other question on those numbers you gave, just so I'm 100%. Election support, was it 420,000 or 427,000?
I'm sorry, it's 420,000, Jacob.
And then when you said commodities and contractuals, dumb that down for me. Is that for PPE? So that's about $2 million for PPE.
1.4 million in commodities. That's everything from PPEs to testing equipment, items that we need. We're trying to get the county courthouse back open, and so we're installing some safety features here. So commodities are things that you buy for PPEs or equipment to help you reopen or help you provide safety to our first responders. Contractuals are services you acquire from a vendor to come in and help you do that, accomplish that same thing. So it was 1.4 million in commodities that they have given us budget authority for, and 500,000 in contractuals.
Rachel from KSN, can you talk a little bit more about the kind of jobs that you're hiring for, the 47 jobs in the health department? How temporary do you plan those to be, and are those specifically all medical related, or are there some that would not need necessary medical? There are many. Let me answer the first question first. These are going to be temporary positions paid for out of CARES money. Right now, the CARES money lasts from now until December 30. So these are salaried and benefited positions, probably county positions that we would hire, but they would end on 12/30. Now, if the CARES money gets extended, and we don't know what's going to happen at the end of the year, with the virus, but it's possible that that money could be extended, then we would extend those jobs as well if we're allowed to do so. But right now, the current rules of CARES money is it expires on 12/30 of 2020. So it's temporary positions. They're full-time and benefited to come in. The second part of your question is medical versus non-medical. Most of these you would have to have some type of health-related background or experience, but some not. And so this money was just approved yesterday. We will be putting out on our website more definition of what these jobs are, and any application through Sedgwick County for these jobs or any others has to go through our HR department. So watch the website, but we will put something specific on our website with these specific positions
and some of the rules that go along with it, the fact that it is temporary and most likely will end on 12/30. We'll put more information out on our website as we move through this. Thank you guys very much. Appreciate you.